English for medical exams, global medical topics, text and audio, practice English for medical purposes, EMP. With this read and listen text audio video covering today's most important global medical topics and contemporary healthcare challenges. Audio is in English, with English and Polish text on screen. Perfect for medical students, healthcare professionals, exam candidates, and ESL learners. Video 1, Topics 1 to 4, 1. Antibiotic resistance and superbugs. 2. COVID-19 and emerging infectious diseases. 3. Telemedicine and digital healthcare. 4. Artificial intelligence in medical diagnosis. 1. Antibiotic resistance and superbugs. Antibiotic resistance has become one of the most pressing issues in modern medicine. When bacteria develop resistance to commonly used antibiotics, physicians face enormous challenges in treating infections that were once easily manageable. The term superbug is used to describe strains of bacteria that are resistant to multiple classes of antibiotics, such as methicillin-resistant Staphylococcus aureus, MRSA. The overprescription and misuse of antibiotics contribute significantly to resistance. Many patients demand antibiotics for viral infections, even though these drugs are ineffective against viruses. Additionally, incomplete treatment courses allow bacteria to survive, adapt, and develop resistance mechanisms. One of the most alarming aspects of superbugs is their ability to spread rapidly in hospitals and intensive care units. Healthcare-associated infections, HAIs, often involve resistant organisms, which can lead to sepsis, prolonged hospital stays, and higher mortality rates. Infection control protocols such as isolation, sterilization, and hand hygiene are critical to prevention. Pharmaceutical research is struggling to keep pace with bacterial evolution. The development pipeline for new antibiotics has slowed, leaving clinicians with limited options. This has led to the exploration of novel therapies such as bacteriophage therapy, antimicrobial peptides, and probiotics. Public health agencies promote antimicrobial stewardship programs to reduce inappropriate prescribing and to monitor resistance patterns. These programs combine clinical guidelines, diagnostic testing, and surveillance systems to optimize antibiotic use. Ultimately, combating antibiotic resistance requires global cooperation. From agricultural policies to clinical practice, every sector of society plays a role in preserving the effectiveness of antibiotics. Without urgent action, common infections may once again become life-threatening. 2. COVID-19 and emerging infectious diseases. The COVID-19 pandemic transformed global healthcare systems almost overnight. Caused by the novel coronavirus SARS-CoV-2, this disease highlighted the importance of epidemiology, virology, and public health preparedness. Modern terminology such as flattening the curve, herd immunity, and social distancing became part of everyday language. COVID-19 symptoms ranged from mild respiratory illness to severe acute respiratory distress syndrome, ARDS. The widespread use of PCR testing, rapid antigen tests, and contact tracing technologies became essential in identifying and isolating cases. The development of vaccines in record time was a breakthrough in biomedical science. mRNA vaccines like Pfizer-BioNTech and Moderna introduced a new era in immunization. Concepts such as booster doses, vaccine efficacy, and breakthrough infections became central to medical discussions. Beyond the virus itself, COVID-19 exposed the fragility of healthcare infrastructure. Shortages of personal protective equipment, PPE, ventilators, and ICU beds revealed gaps in emergency preparedness. Telemedicine also expanded rapidly during lockdowns, providing remote consultations to minimize exposure risks. Long COVID has now emerged as a chronic health issue. Patients report persistent symptoms such as fatigue, brain fog, dyspnea, and post-exertional malaise, raising new challenges for clinicians. Research is ongoing to understand the pathophysiology of post-viral syndromes. Looking ahead, COVID-19 is a reminder of the constant threat of zoonotic diseases, where viruses jump from animals to humans. Strengthening global surveillance, early warning systems, and international cooperation is crucial in preventing future pandemics. 3. Telemedicine and digital healthcare. Telemedicine has become a cornerstone of modern healthcare delivery. It involves the use of digital platforms, video consultations, and remote monitoring devices to connect patients with healthcare providers. Terms like virtual clinic, e-consult, and remote patient monitoring, RPM, are now widely used. For patients in rural or underserved areas, telemedicine eliminates barriers to access. It reduces the need for travel, minimizes waiting times, and allows specialists to reach communities with limited medical resources. This is especially important in managing chronic conditions such as diabetes and hypertension. Digital healthcare extends beyond consultations. Wearable devices like smartwatches can track vital signs, including heart rate, oxygen saturation, and sleep patterns. Data from these devices is transmitted to electronic health records, EHRs, enabling real-time analytics for preventive care. Artificial intelligence is increasingly integrated into telehealth systems. Chatbots, clinical decision support tools, and symptom checkers help patients navigate medical concerns before consulting a physician. Such innovations increase efficiency and reduce the burden on primary care providers. However, telemedicine also raises important concerns. Issues of data privacy, cybersecurity, licensing, and reimbursement must be addressed to ensure safe and sustainable adoption. Many governments are working on regulatory frameworks to standardize digital health practices. The future of digital healthcare lies in personalized, data-driven medicine. As technology evolves, the integration of 5G networks, blockchain for medical records, and predictive analytics will redefine the patient-doctor relationship and improve population health outcomes. 4. Artificial intelligence in medical diagnosis. Artificial intelligence, AI, is transforming diagnostic medicine. Machine learning algorithms and deep neural networks can analyze vast datasets, detect subtle patterns, and assist physicians in decision-making. Terms like computer-aided diagnosis, CAD, radiomics, and predictive modeling are now central to medical discussions. In radiology, AI can detect anomalies on X-rays, CT scans, and MRIs with remarkable accuracy. For example, AI-powered image recognition systems can identify lung nodules, brain tumors, or fractures that might escape human detection. This reduces diagnostic errors and improves patient outcomes. Pathology is another field where AI is making strides. Digital slide scanners combined with AI algorithms can classify tissue samples, identify malignant cells, and even predict prognosis based on histological features. This accelerates diagnostic workflows and standardizes reporting. Beyond imaging, AI applications extend to genomics, cardiology, and infectious disease modeling. Natural language processing, NLP, allows AI systems to analyze unstructured clinical notes, while predictive analytics can forecast patient deterioration in intensive care units. Despite its promise, AI faces ethical and practical challenges. Issues of algorithm bias, transparency, data ownership, and physician accountability must be resolved. Clinicians must be trained to interpret AI outputs critically rather than relying blindly on automated systems. In the future, AI will likely become an indispensable tool in precision medicine. Instead of replacing doctors, it will augment human expertise, enabling earlier detection, more accurate diagnoses, and individualized treatment strategies.